Welcome to today's video about 10 warning stroke signs in women. Did you know every 40 seconds someone in the US suffers a stroke, but there's one group at even greater risk: women? Recognizing a subtle change could make a life-saving difference. In this video, we dive deep into the 10 crucial warning signs of stroke in women. Understanding these signs isn't just informative, it could be life-saving. We'll also explore preventative measures and treatment strategies, empowering you with the knowledge to protect yourself and your loved ones. Before we begin, please help us spread this important message by hitting the thumbs up, and if you're new here, consider subscribing to our channel to stay updated on combating heart disease. Don't forget to click the bell icon so you never miss our new videos. Stick around to find out how to get 2 free gifts for heart health. Let's start our countdown with number 10. Number 10. Sudden numbness or weakness of the face. People often say time is money, but any neurologist will tell you time is brain when it comes to strokes. Every minute counts. Stroke is the 5th leading cause of death in women according to the US Centers for Disease Control and Prevention. Sudden numbness or weakness in the face, arm, or leg on one side isn't just a sign of aging or fatigue, it's often a silent alarm for a stroke. This condition results from the disruption of blood flow in the brain, affecting areas that regulate muscle control and sensation, particularly in women, where hormonal variations can exacerbate vascular conditions. To quickly assess for sudden weakness, perform the smile test by smiling and checking for symmetry. Additionally, conduct the arm test by lifting both arms to see if one arm drifts downward. If you detect signs of sudden weakness through these tests, it is imperative to seek emergency medical care immediately. A quick response can drastically affect the outcome by reducing the risk of permanent damage. Up next, we delve into another stroke sign that often goes unrecognized. Number 9. Mental confusion and trouble speaking. One of the most critical yet overlooked signs of a stroke is sudden mental confusion or difficulty with speech and comprehension. This symptom is a direct result of impaired blood flow to the brain areas governing language and understanding. Research shows that women often fare better at correctly identifying the signs of a stroke. A 2003 study found that 90% of women, compared to 85% of men, knew that trouble speaking or sudden confusion are signs of stroke. During a stroke, the brain's language areas, such as Broca's and Wernicke's areas, may be compromised. This disruption can manifest as aphasia. Unlike common stroke portrayals where symptoms are overt and dramatic, women might experience subtler signs. They might suddenly find it hard to follow conversations or feel words slipping away just as they're about to speak. This confusion isn't just about forgetting a word. It's as if the usual pathways of thought and speech are momentarily scrambled. To quickly assess someone for this stroke sign, ask them to repeat a simple sentence like "the sky is blue." Difficulty in articulation, finding words, or understanding the task can be a potent warning of stroke. Up next, we delve deeper into the less obvious yet equally alarming signs your body might be signaling an emergency. How well do you know your body's warnings? Number 8. Vision problems. Vision disturbances can be some of the first indicators of a stroke. These issues might include sudden blurred or double vision, or even a complete loss of sight in one or both eyes, signaling urgent medical attention is needed during a stroke. If blood flow is interrupted to the parts of the brain that control vision, the occipital lobe or the visual pathways, this can lead to immediate visual impairments. Symptoms might manifest as a sudden curtain-like loss of vision, blurring, or an unusual doubling of everything in view. To test for stroke-related vision issues, cover one eye at a time and notice any changes or loss in your field of vision. This can help identify subtle changes that might otherwise go unnoticed until they become more severe. If you or someone around you experiences sudden changes in vision, such as difficulty focusing, seeing spots, or abrupt vision loss, it's imperative to treat these as stroke symptoms. Coming up next, we explore another unexpected sign that could mean your brain is in jeopardy. Are you aware of how your body's balance and coordination could tip you off to a serious health threat? Let's find out. Number 7. Dizziness or loss of balance. Sudden onset of dizziness or loss of balance are not just alarming, they can severely disrupt one's ability to perform everyday tasks. These symptoms occur when a stroke impacts the cerebellum or the brainstem, areas responsible for balance, coordination, and spatial orientation. Disruption in these areas can lead to severe physical disorientation and might manifest as suddenly tripping or having trouble with stairs. Dizziness could feel like the room is spinning, making it hard to maintain your orientation. Loss of balance might make standing still or sitting upright challenging without support. A quick self-assessment can be telling. Try standing on one foot or walking in a straight line. If these simple tasks are unusually difficult, It could be a sign of stroke-related impairments. Recognizing these signs quickly is not just about identifying a stroke, It's about preventing severe falls or injuries resulting from these symptoms. While dizziness and balance issues clearly signal a possible stroke, there's more to strokes than just these overt symptoms. What other silent indicators might you be missing? Let's explore further. Number 6. Severe headache with no known cause. A severe headache that appears without any apparent reason can be more than just painful. It may signal a cerebral hemorrhage, a form of stroke where bleeding occurs within the brain. During a cerebral hemorrhage, blood from a ruptured vessel begins to pool within the skull, increasing pressure dramatically. This pressure is what causes the intense headache, signaling that brain tissues are at imminent risk. This sudden increase in pressure can cause excruciating pain, which is often described by patients as thunderclap, severe, debilitating, and instant. Unlike migraines or tension headaches that develop gradually, these headaches reach peak intensity in seconds and may be accompanied by nausea or even a loss of consciousness. If you or someone else experiences a sudden severe headache, especially one that feels explosively different from normal headaches, it's imperative to seek medical attention immediately. Up next, we unveil a common experience that could indicate a serious issue. Do you know how your body reacts when balance is compromised? Let's find out. Number 5. Sudden trouble with walking. A sudden difficulty in walking isn't just a sign of clumsiness. It could be signaling a stroke. This symptom indicates that the stroke may be affecting parts of the brain that govern motor and spatial orientation. A stroke impacting this area disrupts its function, leading to abrupt difficulties in walking. Signs to watch for include an unsteady gait, a sudden need to grasp onto objects for support, or a feeling of the room spinning. Vertigo. These symptoms can cause a person to stumble, have difficulty standing up straight, or a sudden fall without apparent cause. Recognizing the serious nature of these symptoms is vital when the brain's ability to coordinate movements is impaired. Immediate intervention is critical to prevent long-term disability. Now that we've covered how strokes can disrupt walking, let's delve into another subtle yet serious symptom that is a major red flag for strokes in women. Number 4. Unexplained fatigue. Unexplained fatigue, characterized by an overwhelming and sudden weariness, can be an elusive but critical sign of a stroke in women. This isn't just ordinary tiredness. It's a profound exhaustion that appears without a clear cause and doesn't improve with rest. This symptom arises when a stroke affects parts of the brain involved with energy regulation and alertness. The sudden onset of fatigue is due to the disruption in how the brain communicates with the body to manage energy levels, often leaving individuals feeling inexplicably drained. This doesn't mean every woman should fear for her life every time they feel unexplained fatigue. The symptoms become cause for concern when they are severe enough to impair your functionality, like feeling so weak and tired you are physically unable to get out of bed. While fatigue might slow you down, another stroke sign could alter your behavioral and emotional state without warning. Stay tuned as we delve into sudden changes in behavior or confusion and why they demand immediate attention. Up next, we delve into another critical indicator that could point to a serious health issue. Number 3. Face drooping or an asymmetrical smile. Face drooping or an asymmetrical smile is not just a cosmetic concern but a serious medical warning sign. When a stroke occurs, the brain's motor cortex can become compromised, specifically affecting the areas that control facial muscles. This leads to one-sided facial weakness, presenting as a droop or an inability to smile symmetrically. Such symptoms are often among the first signs of a stroke, arising abruptly and sometimes resolving just as quickly, which can lead to underestimating their severity. You can quickly check for face drooping using the smile test. Ask the person to smile and observe if both sides of the mouth lift equally. If one side doesn't rise as much as the other, this could be a sign of stroke. Fast diagnosis and treatment can drastically reduce the risk of long-term damage. For women who may experience more nuanced symptoms, understanding and reacting to this sign can be a life-saving measure. Coming up next, we uncover another startling yet often overlooked indicator that can signal a stroke. Stay tuned as what comes next could change how you respond in a crisis. Number 2. Sudden nausea or vomiting without a clear reason. Sudden nausea or vomiting can alarmingly signal a stroke, particularly when they occur without the usual suspects like a stomach bug or food-related issues. This reaction occurs when a stroke affects the part of the brain that controls the digestive system, causing unexpected gastrointestinal symptoms. These symptoms are particularly deceptive because they don't immediately suggest a neurological event, making awareness crucial. Up next, we uncover another subtle yet serious indicator that could mean your brain is under threat. Stay alert. Knowing this next sign could be vital. Before we unveil the top stroke sign to help you take immediate action on what you've learned today, we're thrilled to offer 2 extraordinary free resources. First, we're giving away our guide on 7 foods that support heart health. This list includes delicious options that help maintain stable blood pressure levels. Additionally, you'll gain access to an insightful video on the hidden causes of cardiovascular issues and effective solutions. This innovative approach can help restore optimal heart health. To access these resources, click on the link in the description below. Now let's return to our countdown and unveil the number 1 stroke sign that stands as a pillar in the 10 warning signs of stroke in women. Number 1. Brief loss of consciousness. A sudden brief loss of consciousness, often termed syncope, can be a terrifying and critical warning sign of a stroke. This symptom occurs when the blood supply to the brain is temporarily disrupted, causing a sudden blackout or fainting episode. Loss of consciousness during a stroke might happen due to a decrease in blood flow to the brain's vital areas that regulate awareness and wakefulness. This can lead to an abrupt and brief blackout where the person might collapse or faint without warning. It's different from simply feeling lightheaded or dizzy. It's a total, though brief, loss of responsiveness. This alarming sign serves as a critical indicator that immediate medical intervention is necessary. The sudden loss of consciousness, even briefly, can signal a severe interruption in brain function that requires urgent attention to prevent further brain damage and ensure safety. As we conclude, preventing strokes involves adopting lifestyle changes and taking preventative measures. Regular health checkups are essential for monitoring blood pressure, cholesterol levels, and overall cardiovascular health. A healthy diet and regular exercise can help manage weight, lower blood pressure, and reduce the risk of stroke. So, there you have it. 10 warning signs of stroke every woman should know that could very well save a life. From sudden numbness to trouble speaking, being aware can save a life. Unique risk factors like hormonal changes emphasize the need for tailored preventative measures. Regular health checkups, balanced diet, and exercise play key roles in reducing the risk. Knowing how to respond during a stroke emergency and using the Be Fast method can make a significant difference. Now I want to hear from you. Have you or someone you know ever encountered these symptoms? How was the situation handled? Share your stories below to help educate others on this critical topic. If this video has opened your eyes to the crucial signs of stroke in women, please show your support by hitting the like button, subscribing to our channel, and clicking the bell icon. For those considering showing extra support, the Super Thanks feature is a great way to help us continue providing valuable health insights. Before you go, remember to check out the 2 exclusive free resource links in the description below. Thank you for watching, and remember, recognizing these signs on time could be life-saving. Stay informed, stay safe.